Okay, well, good afternoon, everyone. Thank you for joining us to the first virtual collaborative Black Health Summit 2021, hosted by the Center for African American Health. My name is Malia, and I am the Director of Policy and Advocacy with the Center for African American Health. And it is my pleasure and honor to be the MC for our webinar, which is going to be recorded. We realize that there's several other sessions going on where participants may join in later on. But this webinar being Medicare Made Easy, get your questions and answers. We have quite a few panelists who are going to present on the topic. Before we get started, I want to give thanks and recognition to our summit sponsors, specifically the Colorado Health Foundation, Colorado Access, Novartis, and Common Spirit to make everything possible today, and this being day 2 of our summit. Also, we'd like to give thanks to Rocky Mountain Public Health Training Center. They are providing our session support. You do have, and you're not being seen, the only thing that you'll see or should see on your screen are our presenters. But you have a Q&A box at the bottom. Please feel free to submit any questions that you may have, and they'll be answered accordingly. You also have the chat screen, and we encourage you to provide your own introduction of your name, your title, what city and state you're joining in from. And I will go ahead and turn it over now to our panelists, and thank you and enjoy.
Hello, thank you so much for having us, and good morning. Happy Saturday. My name is Ashley Chavez. I am the sales manager for the Colorado market for Bright Health. We are a health insurance company that started here in Colorado, so the state is very near and dear to our heart, but we have launched into 13 other states here in the last 5 years. And today we just wanted to come to you. We have a couple other people on as well as panelists, and just have it be an open forum, question and answers, to where you can, get the help and the answers that you need as you're aging into Medicare, turning 65. So I'll kick it over to Joe. He is our broker. He's one of our top producers in El Paso County, and he's going to be representing Bright Health today and helping answer your Medicare questions. So he's definitely an expert and a guru. And so I'll let him introduce himself and tell you a little bit more about what he does. So.
Hey, Ashley, thank you so much for doing that.
Yeah.
Happy to be here. Yeah, my name's Joe Moore, and Medicare is kind of my life outside of my family. So I live in Colorado Springs, but I work all throughout the state of Colorado, helping people figure out what to do with crazy Medicare, So we're here today to help you kind of figure that out, when to start, what to look at, and what's going on with your particular situation. So I look forward to answering any questions out there that I can for you today.
Wonderful. Thank you so much, Joe. So as you do have questions, also feel free to put them in the chat. But I do have some questions prompted for you, Joe, if you'd like to go through as like a mock interview. People know what to expect. So as we do kind of talk about Medicare, please feel free. I'll be watching the chat box. So, feel free to ask us any questions that you have. If you would also like to set up a one-on-one appointment with Joe, this is what he does full time. So he helps people with their health insurance, specifically Medicare. So, please feel free to provide us your contact information, and Joe can follow up with you, and, he can have a more personal discussion with, with what your needs are or what your questions are that you need answered. So I think just to kick it off, Joe, if you can talk to us a little bit about just the basics of Medicare. So like, part A, B, I always call them like the ABCs of Medicare. So if you can kind of go over the different parts, and then, so the ABCs and Ds of Medicare, and then kind of like their Medicare options as far as like Medicare, original Medicare, Medicare Sups, Medicare Advantage, and Part D, because they're all going to hear a ton about that. And then we'll jump into like what to do. So how to apply and kind of where to go to do that. So first, if you want to cover the different parts of Medicare, that would be great.
Absolutely. So of course, there's Part A and there's Part B, and then there's Part C and D. So there's some other ones out there, other letters that you'll run into. Mainly, Part A of your Medicare is your hospitalization, and typically you qualify for that by working. 10 years or 40 quarters. So you pay into the system, and that pays for Part A of your Medicare. And then there's also Part B of your Medicare, which is doctor and outpatient surgery. Okay. So anytime you go to your doctor, you're going to, Part B of your Medicare would pay for that. Part B of your Medicare also pays for Part B medications. Those are things like chemotherapy drugs, osteoporosis, oral cancer injection medications, anything your doctor has to give you in their doctor's office. Okay. So A and B combined cover 80% of your medical benefits. And then, of course, there's Part C, which you'll see the TV commercials on TV. It's called Medicare Advantage. So when you hear Medicare Advantage, think Part C and vice versa. And Part C or Medicare Advantage are administered by private insurance companies. So Medicare appoints certain private insurance companies to administer the plan of Medicare for them. So they can kind of be hands off and let those professionals at insurance do what they do. Okay. With Advantage plans, you typically get things that Medicare do not cover. Dental and vision and hearing, routine podiatry, a routine physical or full physical every year. Sometimes transportation benefits and gym memberships, things of course that you see on TV. So that's what Advantage does for you. And those come in the shapes and forms of HMOs and PPOs and different things like that. So that's going to be a Part C or Advantage plans. And then Part D of your Medicare covers your normal prescription drug coverage. Okay, so if you go to the pharmacy and you pick up a prescription, then Part D of your Medicare would cover that for you. So those are the four main parts of your Medicare: A, B, C, and D. Did
Awesome.
you go ahead? I'm sorry, Ashley.
Oh, that's perfect. Thank you. And then people hear a lot about original Medicare, Medicare supplements, PDPs, or Part D plans. What are the differences about those?
Okay, so if you ever hear the term original Medicare, that is usually speaking to just having Part A and B of your Medicare. So that's kind of the simplest part of Medicare, is just getting that A and B in place. And then once you get that in place, you have to figure out how are you going to cover the other 20% that Medicare doesn't cover, and also how are you going to cover your prescription drugs. Okay, so with original Medicare, you have a couple options, and I always say option one would be a supplement. So you have your Part A and B, and then you buy a secondary insurance called a Medicare supplement plan. And those can be F and C and K and L and I'm sorry. There's quite a few different supplements out there. And we look at those based on what kind of coverages and the cost that you might need when it comes to a supplement. Also, the supplements do not include prescription drug coverage. So that's where you'd have A and B of your Medicare, the supplement, then you'd have to purchase a standalone prescription drug benefit to take care of your medications. Okay. And then actually, I apologize. You asked me a question, but you said supplement.
Supplement, original Medicare, and Part D. So
yep. Okay, I did hear. Okay, great. So that's how that works. You pretty much, when you're doing original Medicare, you're buying everything a la carte. So in general, Part B of your Medicare in 2021 is going to cost you $148.50 per month. So that's going to typically come directly out of your Social Security if you're drawing it. If not, you'd be billed quarterly for your Part B of your Medicare. Okay. And then you would purchase also a supplement, and then you'd also purchase a drug benefit. So those are pretty much, you buy them individually, standalone policies.
Perfect. Yeah, so as you can tell, there is a ton of different parts of Medicare. It can be extremely confusing. It can be, very cumbersome. There's timelines that you have to follow. There are penalties that could be in place if you don't sign up when you should. So Joe, can you review kind of what to prepare for, or when they should start this process? What does that kind of look like as far as applying for Medicare? Where do you go? What do you do? And just kind of what should they prepare for as they turn 65?
Sure. I've been doing this now. This is my 11th year. So over time, I've kind of changed when I think people should start looking into their Medicare. So when you start getting ready to think that, hey, I'm going to qualify for Medicare here soon, which is usually at age 65, and it can be earlier due to a qualifying disability. So you may get your Medicare earlier than that. I encourage folks to start looking, 6 months to even a year ahead of time at what it's going to look like for you. If your income exceeds $85,000 as an individual, you're going to have a higher Part B premium that you're going to need to pay over that $148.50. And if you're a couple and your income exceeds $175,000 tax-wise, then you're going to also have a higher premium. So you have to start kind of looking at these things. Are you going to travel? Are you going to keep working? So if let's say you're 62 years old and you decide you'd like to start drawing your Social Security early and you don't want to wait on Social Security, then at 65 or 3 months before you turn 65, you're going to automatically receive your Medicare Part A and Part B card. Okay, so if you're already drawing Social Security, you'll automatically get that card. If you say, I'm not going to draw my Social Security, I'm going to wait till I'm 70 or 68 or whatever you decided to do, then you're going to need to go and apply for Medicare. Okay. Currently with COVID, it's kind of tough. You can't really go to the office, but you can go to ssa.gov and you can apply for Medicare there. You can also call your local Social Security office and schedule an appointment ahead of time to have a phone conversation. In case you're not as tech savvy or not as comfortable doing things online, you can actually just schedule an appointment over the phone to schedule for Part A and B of your Medicare. Okay, so yeah, 6 months in advance, 12 months in advance, and that's how you would apply, ssa.gov, or you can call your local Social Security office.
Great. Wonderful. I think one of the biggest assets that isn't necessarily used all the time is people such as yourself. So brokers that do this professionally, like as you said, you've been doing this 11 years. This is something that you eat, breathe, and live Medicare, right? Yes. So I think that a lot of people aren't aware that brokers such as yourself are in this position to help them through this process. So why would you say somebody should use a broker, and what are the services that you can help provide?
Absolutely. Great question. So it costs you the same amount of money to use a broker as it does to call a 1-800 number. Okay. The difference is when you call a 1-800 number, you're going to get a different voice every time you call back. When you have a broker, someone local in your area that you can meet with face-to-face, who was with you when you initially got into Medicare and knew some of your health issues and maybe some of the concerns you had or how you travel or your income limits, you have a relationship that you build. So what I typically do for my clients is meet with them once a year if they choose to. Some of them just call me and say, hey, Joe, what the heck is changing next year? And I just tell them over the phone, and they're good with that. And some people do like to meet every year. The value of a broker as well is I work with multiple different plans, and things are always changing all the time. So you don't have to keep up with what's changing. You don't have to watch the TV commercials as much. You can just call me and say, hey, what's going on with this? What's going on with that? So you have your own personal special contact that can actually help you navigate year to year, if necessary, kind of what's going on with you. So it's I think it's very valuable. And there's a lot of things that people assume, I got my Medicare set up, I don't need to do it again. Well, things change. I've had folks lose their Part B for some random reason, and we end up on the phone with Social Security for 3 hours, and then they transfer or tell us we got to call Medicare for another 3 hours. But we have those calls, and we do that together. There's things that person may not know what to ask, that I know what to ask, the terminology and what's coming into that. So it's if you can find a local agent, it's very valuable to have that person help you navigate through what's out there for you and how to help you when things break down. So.
Yeah, I agree. I think it's great to have that person as your advocate, and brokers can play kind of the middleman between your health insurance company and yourself, and kind of how to navigate all the different jargons and resources and just things that can be helpful. So they kind of act as your advocate on behalf of yourself and between you and your health insurance. So It's super important. And you mentioned a cost of that service, and what is that cost?
Zero.
Right.
Exactly.
Yep. So as a sales manager, just so you all are aware, that brokers get paid by the health insurance carrier. So similar to like auto insurance or stuff of that nature, that is a no cost service to you. So don't ever hesitate to call and speak with the broker to get your questions answered and get some help. So Medicare can be very confusing. There are a lot of different health insurance carriers out there, and they all do different things. They all have different services that they provide. So using a broker such as Joe is a great resource and can really help you navigate your health insurance and your health care. So thank you for that.
And actually, real quick, to just add to that just a little bit. So, and that's really how I built my business is helping people, give it away for free, the information, and let them know that you're there. And people, I say, how do you do that? And again, as Ashley said, we are paid directly from the insurance company. So I just want to help you figure this all out. And if I do a good job at that, you'll stay with me as an individual, and we work together. So.
Yeah, and Medicare does require that all health plans pay the brokers the same. So, whether Joe signs you up for, United or Bright or Humana or, whoever it may be, it doesn't matter to him, as long as his client is well taken care of. So he does what's in the best interest of the client, which is always great. So we do have a question. Thank you so much for your question. So with the increase of Medicare beneficiaries from the kind of like the aging in baby boomer generation, do you anticipate that there would be a bigger price tag for Medicare? And if so, should anyone worry about Medicare like long-term ability to provide quality, affordable health coverage?
Loaded question.
What has been your experience in the last 11 years that you've been doing that? What have you seen play out?
Great question. So when I started in 2010, Part B of Medicare, I think, was $99.80 or something like that. And then it went to 105, then it was 120, and then so on and so forth. So what I have seen, which I think is amazing, all the benefits keep getting better and better and better, because the idea of, especially Medicare Advantage, is designed for better healthcare outcomes. So it's designed to be preventative. So there's a lot of benefits that are added to your plan at no cost to entice you to go get a physical. Hey, we're going to give you a little extra money. We're going to pay for a gym membership for you. And there's different things out there that kind of really help. So I don't believe that the services will go down at all, what people are going to receive from Medicare. I could see maybe Part B continues to slowly rise. Even Part A of your Medicare has a deductible. The Part A for 2021 is $1,484. The first time you go into the hospital, if you were to have that happen in 1 year, your Advantage plan typically will pay for that. Okay, or if you're on the right supplement, it'll also pay for that. That has gone up. Last year was 14. Was it 14? It went up like $84, I think, actually.
Something like that, yeah.
Yeah. So those change. The Part B of your Medicare, the first time you go into to see your doctor of the year, you typically will pay a deductible if you had original Medicare. This year, it's $202. Last year was $198, and so on. I can just back that down. So I think that'll continue to increase, little changes. Mm-hmm. But the big picture of what Medicare is doing for people, I think, is going to stay amazing. I think it's the best thing out there. Anyone, if you get a hold of Medicare, you go, oh my gosh, this is great. So yeah, I think Medicare is amazing. I don't think it's going to go down as far as
for quality. Sure. Yeah. Especially people coming off of employer coverage, or we're all pretty used to high deductible health insurance plans now, whether you're through your employer or on the individual health plan exchange. Those costs are so high. And then when you get into Medicare, you're like, whew, thank goodness.
Exactly.
I can't wait to get onto a Medicare plan.
Yeah, absolutely. I don't want to rush it, but I definitely look forward to the cost.
Yes, absolutely.
Yep.
No, that was a great question, and please keep them coming. So let's see, we went over applying. So talk about what should you do if you are on an employer plan. Let's say you're still working. As we all know, the retirement age continues to increase, and you know, even my grandparents, they just retired, you know, the last year or two. So if you are on employer coverage or you're covered through a spouse, what are your options for that?
Yeah, so there's a lot of things. And the first thing to do is look into it. You know, I work with some companies around town. Like I worked with Compassion International for quite a few years, and they have over 800 employees. And you might be Medicare age and considering working. So what I can do is sit down with you and say, let's compare if you just take your group policy and keep going, or should you go ahead and apply for your Medicare now and still keep working? Because you can do that as well. So and the only time you're going to run into trouble with something like that is if you have a significant other who relies on your insurance. So all Medicare policies are individual policies. So if you've got that, you know, I'm 65, spouse is 62, and they rely on me for their insurance at work, then you're going to probably need to wait 3 years, right? So you guys are both Medicare eligible. But if you have the option of being able to look at either, or if you're an individual not worrying about someone else as their insurance, definitely do your homework and see if it's more valuable. So go ahead and take your Medicare plan. A lot of times it is, to be honest with you, in the most cases that you look at, unless you have great insurance, obviously. But
Yeah, for sure.
Yep.
No, that's fantastic. Yeah, so you have different options, and it's important to, you know, look at those options and make sure that you're picking the one that works best for you, your family, you know, whatever that may look like. So, you know, again, Joe's a great resource to sit down and help you kind of navigate all those different options. Let's see, what else did I have here?
You know what, Ashley, too, real quick. So even if you guys, obviously we're here, in the chat, you can also put your, you know, if you want more information, I believe it's a private chat that actually has their eyes on there. You can put your mailing information there. We can always send you information in regards to that. You can also, I have a website that's mine. That's joeamore.com. And it's MOORE, just joeamore.com. And there's a number of frequently asked questions on there. Some of these things that we're talking about. So you can always, obviously you'll see this, but you can also go back and it'll ask you if you know, where do I start? And do I have TRICARE, or I have VA? Do I need anything else? Those kind of things are always there for you too.
Yeah, that's fantastic. Thank you. Looks like we did put that in the chat, so thank you. And then we have another question here. So I've heard that minorities were particularly impacted by gap, frequently referred to as the donut hole, so the coverage gap, which causes disruptions in drug therapy. Yeah, so adherence to medication therapies, specifically among minorities and individuals with low socioeconomic standings. Can you explain kind of Medicare Part D and how that works?
Yeah, absolutely. So being referred to, as you said, the donut hole or the coverage gap. I heard 2 years ago this is supposed to go away. It hasn't gone away yet, but they just keep kind of revamping it and moving things around. So it's try to stay with me on this one, because it gets confusing when it comes to the donut hole and the coverage gap. So typically there's 4 stages when it comes to your prescription drug coverage. So if the plan that you've selected has a deductible, once you meet that actual deductible, and it could be $75, it could be $0. You know, Bright Health actually has a great benefit on theirs. But it can be these different variables as far as once you meet that deductible, then in essence, you enter the first stage. That stage is called your initial coverage stage. And the way it works is each individual who has a Part D is going to have a certain amount of money set aside for them. And that money goes toward the cost of your medication. And the key word is their costs of the medication. So in 2021, each individual with a prescription drug benefit is going to have $4,130. And I call it kind of an escrow account. So that money is set aside for you and it goes again toward the cost of your medication. So if you go to King Soopers or Target or Safeway or Walmart or wherever you get your prescription, you're going to have a copay when you buy that particular medication. And it might be an $8 copay or a $2 copay, but the drug has a true cost. So let's say the drug truly costs $30, okay, but you gave them $8, all right? Then you'd have $4,100 left to go toward your prescriptions for the rest of the year. So every time you pick up a medication, the true cost actually comes off of that $4,130. All right. If you ever use up that $4,130 in the same calendar year, because it does reset, then you fall into what they call the donut hole or coverage gap. And what typically happens at that stage is instead of paying $2, $8, $15, $45, whatever that copay is, you start paying 25% of the cost of your medications. So let's say you take insulin. Those are typically very expensive medications. A lot of inhalers are very expensive medications. So if they cost $400, let's say, your copay just went from, let's say, $40 up to, I don't know, $75, $125, depending on what it is that you're actually taking. Okay. So that's what happens in the donut hole or the coverage gap. So there are some ways to kind of, you may qualify for to help defend yourself through that donut hole or coverage gap. Okay. To get out of the actual donut hole or coverage gap, you must spend $6,550 out of your actual pocket. So again, let me go back up just a little bit. In the initial coverage stage, you have $4,130 that goes toward the cost of your medication. Okay, so those are copays. Bing, 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 bing. You use all that up. Okay, then if Medicare kind of tries to trick you and confuse you a little bit, and now they go, well, how much did you actually spend out of your pocket? So you actually have, in the same year, have to spend $6,550 out of your pocket. If you do that, then you fall into catastrophic coverage. And at that point, the plans roughly pay 95% of everything. You'll pay $3 or $8 or 5%, but typically the plans pay 95% of everything. So there's a couple things you can do. If you qualify for Medicaid in the state of Colorado, you'll still have a donut hole, but the state will pay the difference through that donut hole or coverage gap stage. Okay. If you qualify for TRICARE for Life, you have a whole nother set of rules you play by. VA, you can have prescription drugs through VA, you can avoid that. But what I do with most of my clientele, if you think you're even close to qualifying for assistance, and actually maybe you can help me here. I know in 2020, the extra help line number, the qualifier income wise, is $1,546. Okay, with a $20 disregard. So they'll look $20 over in a way over that $1,546. I don't know if it's gone up yet. The new numbers come out in March, so I'm not sure how that works. But the way it works is there's a sliding scale, and that money, if you make $1,546 or less, then you get what's called extra help or limited income subsidy. And at that point, you qualify for Medicaid benefits without qualifying for full Medicaid. So it's going to help pay for your medication costs through the donut hole or coverage gap. Other than that, the best way is to try to take generics. Some things there are no generics for, so it's kind of really tough out there. But if there's a generic that falls low on tier levels, that again we could discuss in more detail. But if we can find something that's less expensive, that's going to keep you out of the donut hole as well. But if I can help you apply, I do it all the time. I keep it on my desktop, an application at Social Security to help with extra help. You can always reach out to us. We can do an application. It takes less than 10 minutes to do one of those, and we can see if we can get you some help paying for your prescription drugs.
Yeah, and I would say that that's probably the biggest disparities, is that people just don't know that these programs are out there and that they exist. And the extra help or the Medicare savings programs through the state,
Yes.
They're there, and they're there to help people with these costs. And if people aren't working with a broker or don't know to ask the questions, it's not really readily available. It's not talked about much. So, it's such an incredible service. And it's definitely there to help. So, please make sure that you're checking into that. If you are having problems paying for prescription drugs or, out of pocket for your care, we can certainly help with that. And so I'm going to put up just really quick, I'm going to share my screen and put up, Joe, I have a slide with your contact information.
Okay.
So I'm just going to put this up on the screen for a few minutes. And that way, if you do have questions and want to reach out to Joe personally, this is where you can do that through. But there was another chat question here. Let me get back. Get back to the chat. How about, this is a good question. How about in related to COVID, do you know kind of a little bit about the Medicare coverage and the costs in regards to COVID-19?
As far as the vaccine goes, there's no cost.
Yep.
So you can, take advantage of that. And you do not need to, I just learned this recently, honestly, because I've had a lot of clients call me on this. If you have a plan and you want to go to, let's say you're not with Kaiser, but you like to go to Kaiser because they can give you the shot, you can go there. You don't need to go to just your in-network type of place to get the COVID shot. So there's no cost as far as COVID goes. I know in 2020, a lot of the plans came out and were very helpful with assisting folks through COVID as far as paying for some of their co-pays and things like that. But as far as just the COVID shot goes, I know there's no cost for that.
Yeah, and it could vary by plan. So it's always good to check your plan, even their website, or, call into customer service. I know with us, we don't charge for any sort of, testing or anything like that. But let's say, and I think that this is pretty standard, is that if you were to get hospitalized, then that would fall under your normal, cost of like hospitalizations or, things of that nature. But for the most part, the test and the vaccine are no cost to the members. So, but just as a caveat there, it could vary by plan. So just make sure that you're checking with them. I can only speak to Bright. I don't know if you have any other comment on that, Joe, if it's different.
No, I think you're spot on. It's pretty much going to be a zero right now, but yeah, great. Yeah, definitely call your provider if you're not sure, or your insurance company to find that out. But for the most part, as far as I've heard, they're all zero for the testing. And if you do end up with some complications and end up in the hospital, it would fall back on your original, your plan, how it normally runs. So,
yeah, perfect. So let's see here. So as people are looking into a Medicare plan, whether it be, a MedSup, Medicare Advantage, or staying on original Medicare, what are some things that they should consider? And, so what does a normal kind of like a needs analysis appointment look like for you? What are you going over with them that they should look for their health insurance?
Absolutely. So one of the very first things I look at is who their doctors are. So I try to keep my clients with their same care. So it's continuity, like they're not switching their specialist, right? Or their primary care doctor. Are they going to travel? They're going to leave the state for 6 months. Are you going to be here? Are you going to travel for a couple of weeks at a time? Because they're very different in how you maybe want to look at a plan. Do you take a lot of medication? That's important, and we can look those up ahead of time to also evaluate which plan might be better just medication wise as far as what you're going to be paying for those particular prescriptions. So I look at that as far as needs analysis. I look at income a little bit if the client brings it up, but with these Advantage plans, most of them are zero premium. So there's no additional cost to have the Advantage plan, just paying for Part B of your Medicare, and then that qualifies you A and B, and then you can enroll in an Advantage plan. So really looking at what fits that person's needs, their transportation, do they have a vehicle? Can they get to their doctor's appointments? Those kind of things that kind of come up naturally by having the normal conversation. But yeah, mainly it's the doctors, it's travel, and what are their individual personal needs that they think that are important to them as far as, traveling or hearing aids or, whatever that might be. But,
Yeah.
those kind of things. Yep.
Yeah, that's great. So we do have a couple new people that joined into the session here. So thank you so much for joining us today. So this session, we're just going over kind of Q&A about Medicare and all the different options that you have available to you. Joe here with me is a licensed insurance broker that all he does is Medicare. So he lives, breathes, and eats Medicare health insurance, which, may not sound like fun, but it's a great business. It's a great opportunity to help people, which I think, we're, at least if you're in health insurance, you're here to help people that you serve.
Absolutely.
And, we really appreciate Joe being here. I'm Ashley. I am the sales manager with Bright Health here in Colorado. We're a Medicare Advantage plan. We also do under 65 plans or individual and family health plans. So that is a great question. We have a question here. What happens if you don't sign up for Medicare at age 65? Is there a late enrollment penalty?
Yeah, there's a couple things you want to be careful of. So Part A, again, of your Medicare is going to be pretty much automatic because you've worked 10 years or 40 quarters and you've been an American citizen for 5 consecutive years. So Part A, typically, of your Medicare is handled. Part B is something that you elect to have. So it don't make you have it. However, if you choose not to take Part B when you're eligible, then Medicare can assess you a 10% a year penalty for every year that you skipped out on Part B. Now, if you're working and have what's called credible coverage, and credible coverage meaning just as good as Medicare or better, something like group coverage at work, right? Then you do not need to apply for your Part B. You will not be penalized. All right. But if you don't have any other coverage, go ahead and get your Part B to avoid that penalty. Also, and the penalty doesn't go away. So it's 10% a year on top of the $148 a month. And as that number possibly goes up, well, so will your penalty, right? So that's something to think about. And then also your prescription drug benefit has a penalty to it. Again, you want to enroll in a prescription drug benefit when you're eligible. If not, and you don't have credible coverage, meaning good or just as good as Medicare or better, then Medicare can penalize you 1% a month for every month that you miss, that you did not accept your Part D. And I've had clients do this. I had a gentleman I met, this is probably 4 years ago in Canyon City. He never enrolled in a drug plan because he didn't take any medication. And 10 years later, he needed medication. So he had 120% plus penalty. And the penalty is, let's call it a 10% penalty, right? It's 10% of the national average cost of a drug plan. And in 2020, it was $37.48. I'm grabbing that out of the air. I'm pretty sure that's the right number, but I'm not for sure. And it could be like $40 now. I'm not sure. But so you're going to pay, 10% of $40 or something like that. But again, the issue is it goes away and it's your money and it's going to be gone for the rest of your life. So definitely look into enrolling in a prescription drug. And again, that's when Medicare Advantage, again, has a huge value, because if you're not taking any medication and you're like, I don't want to buy a drug plan for 35, 40, 50, $100 a month. Why would I do that? I don't take any medication. This isn't fair. You can join an Advantage plan, have no premium. You can avoid the penalty and have the drug coverage later if you need it. So just a huge value of Advantage plans for those people who qualify or to meet those criteria. Yeah,
that's great. So with an Advantage plan, you continue to pay your Part B premium, but there's no premium to have the plan, which includes all Part A, Part B, and Part D. So it's a great option. That's why they call them Advantage plans.
That's right.
So a couple other questions, Joe. So we went over what happens if you sign up late. Are there income limits for how much you can make for Medicare?
Not at all. So, one of my pet peeves right now is these Medicare commercials on TV. And they say, if you qualify, you may receive a 0 monthly premium and et cetera, et cetera. If you want it, you qualify. It's not due to your income. You can make $1 million. You can make $2. It doesn't matter. If you want an advantage plan or a supplement, you can do that. It's regardless of your income.
Yeah, that's great.
Yeah.
There may be income limits for some of the, kind of the subsidies or, savings programs that are available, but yeah, there is no income limit for Medicare. So kind of tying back to that question about the penalties, Joe, can you review the different enrollment, what are they called? Enrollment phases?
Yeah, the different enrollment periods.
Yeah, thank you. Periods. Yeah. When
there you go.
enroll? That's a great question. When can you enroll? And what if something changes?
Yeah, absolutely. So initially, you have what's called your initial enrollment period. It's called IEP, and that is 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So you actually have a full 7 months to decide, what do I want to do without worrying about any penalties? Okay. Now let's say you move on past the 65th birthday and you're still working for an employer, and you're 67 now, and you decide in June that you would like to retire and take your Medicare benefits. Can you do that? You can. That would be called a special enrollment period. So you'd have, I think it's 62, 63 days. You can go without continuous coverage without drawing any penalty. So again, that's where a broker could come in handy, where you would just say, hey, Joe, I'm thinking of retiring. What do I need to do next? I would have you apply for your Medicare in advance, plan that out. We look at plans for you, and then you just start right away with no issues. Is this just for initially enrolling? Or are you talking about all enrollment periods?
Yeah, let's go through all of them.
Okay. So then that would be one of the special enrollment periods. Some other special enrollment periods are if you move from one county to another, and that other county has a different set of plans than what you were offered in the previous county, you can change your plan there. From one state to another, you can change your plan. Again, if you end up qualifying for Medicaid, and maybe you didn't qualify for Medicaid at first, now something in your life has changed, you had a reduction, say, in your income or something like that, you can also opens up a special window for you. Anyone who qualifies for extra help, assistance, or Medicaid, you can also change your plan every quarter. I don't advise that, but the reason that's there is in case you picked something wrong, or again, something changes and you need to modify your plan to help you with your current situation. So that's another window. And there's also the big one. This is the one you always see on TV, and that's the annual enrollment period. That's from October 15th through December 7th every year. And that's for anybody who has a Medicare Advantage or a standalone prescription drug benefit. They can change that plan, add, switch, drop, whatever you want to do during that 7 weeks. And then those changes take effect the first of the year. Okay. And there's also a hidden one, which we're currently in right now. And they don't advertise this on TV. I don't know if they will. It's only been around maybe a couple years. Maybe,
yeah.
Ashley, you think?
I think second year now.
Yeah, it's the second year. Yep. It's called Medicare Advantage Open Enrollment Period. And I kind of like this benefit a lot. I'll give you a couple of examples of how this works, because I've had run into this over the last few years. You sign up online for a Medicare Advantage plan, and you were under the assumption that that plan included prescription drugs. January comes, you go to fill a prescription, and you have no prescription drug coverage. In years prior to, I think, like 2019, 2019, you were stuck the whole year without prescription drug coverage, a Part D, and you would be penalized the next year when you went to get that prescription drug benefit. Now, there's a such thing called Medicare Advantage Open Enrollment Period, and it's from January 1 to March 31st. So anyone who has a Medicare Advantage plan and they want to switch to an HMO to a PPO, PPO to an HMO, an Advantage plan with no prescription drug coverage to one with prescription drug coverage, you can do that. You can make a one-time change between January 1 and March 31st to make sure that the rest of the year goes well for you. Okay, so they don't advertise it yet, but that does exist. So there is the open enrollment period. All right.
Yeah.
I know there's a lot. Did I miss any regular ones?
No, I don't think so. Yeah, just like leaving employer coverage, moving, yeah, OEP. I think that covers pretty much all of them.
Okay.
And then there's a question, can you clarify the type? Oh, that might be in regards to the closed captioning. Let me know if you had a different question, and we can answer that.
Okay.
Oh, can you clarify the different types of enrollment? So do you mean, so there's, let me put up this slide, Joe. I have a slide here.
Okay.
This might help. Sorry, I got to find it. I had this up and nope, not that one. Let me move this while I find it here. Yeah, nice job. Does anybody else have any other Medicare questions? Maybe you're running into something currently and you could use some help kind of navigating how to get around it. Here's a slide.
Okay.
So yeah, so there's your initial election period is when you turn 65. You have 7 months. So the 3 months before, the month of your birthday, and then 3 months after. If you enroll during that time frame, you will not be penalized. Also during AEP, that's the normal one that Joe talked about. So October 15th to December 7th every year, and then that goes into effect January 1st. We're in open enrollment right now. So if you do have, if you're on a Medicare Advantage plan as of January 1st, you can make a change until March 31st each year. And then special election periods are things like, if you're moving or, if you get, let's say, you get a divorce or you have some sort of special life-changing event, you can typically change your plan. I just always, again, tying things back to using a broker, when these things come up, you have a time frame that you have to follow. So making sure that you're, contacting your broker and walking through that time frame and making sure that you're making these changes when you're supposed to. That way you don't either get stuck without insurance or without, a plan that works for you would be important. So let's see. Okay, so the type of enrollment that pertains to one becoming disabled. So I'm assuming that we're talking about like the 24-month period. Yeah, can you expand on that, Joe?
Yeah, I would assume that's maybe what that is. So if you do in the unfortunate event you end up with a qualifying disability that allows you to receive your Medicare before 65, then you typically get that qualifier and you must wait 24 months in order to actually get your Medicare benefits. And again, when you do, you'll have the same initial enrollment period that someone turning 65 would. So you'll have 3 months before that, 24 months, the month of, and then 3 months after that. And then actually when you turn 65, I've had this happen too. I've had people have penalties by not doing anything because they got their Medicare early, especially the military. Some of the ladies and gentlemen who end up with, qualifying for Medicare early due to their time at war, things like that. They don't do anything. They think, oh, Medicare's for old people or whatever they kind of think, and they don't do anything with it. When they want to get their Medicare later, they end up penalized, right? So when you turn 65, let's say you get your Medicare at 61 or 62 or 59 or 38. I have clients that are 38 years old. If you actually end up then at 65, you get what's called your IEP2, which is your initial enrollment period number 2, which all those penalties reset. So your Part B penalty, if you had one, goes away. Your Part D penalty goes away if you had one as well. So you do it, your initial amount is the same on disability, and then you get a whole new start window at 65.
Awesome. Thank you so much. Oh, I had my email up.
Yeah, it popped up. Yeah.
That's boring. So we were trying to get my screens all situated. I work off of 2 screens, so I never know what's showing. So you want to see Joe. Can you work at age 65 and also have employer insurance coverage with Medicare?
Well, I think you can. However, I usually encourage people not to do that, because what generally happens is no one wants to be the primary. So Medicare generally becomes the primary of anything. So your employer is going to say it's their bill, Medicare is going to say it's their bill. And all I've really seen in time is that it causes chaos. If you want Medicare, go ahead and get it. If not, you really can't use it like you want. So you'd be kind of wasting that Part B premium, and you don't need to worry about the penalty. So I tell folks, pick one. I think you can have it, because I've had some folks be okay with it, but I put it to you this way: I don't like to sell exceptions. And to me, an exception to the rule would be to have Medicare in a group policy. You don't need to really go that route.
Yeah, I would agree with that statement. I've worked for an employer group plan before, and I was in charge of enrollment and doing coordination of benefits between Medicare and employer plans, and it is a disaster. So yeah, I would advise against it as well from an administrative point of view. But again, you can go through your own personal situation to find which one would be best for you
Exactly.
and your needs. So I just want to note the time here. We have about 9 more minutes. And so, I just want to, personally thank you, Joe, for, coming on and helping answer all of these questions and just providing additional information. And so to kind of wrap up the call, I would like for you to go over kind of what sets you apart from other brokers that you think of. I can tell you what I think. I manage about a little over 600 brokers between 2 states. And I can tell you that working with Joe over this last year, as we've expanded into El Paso County, has been like a breath of fresh air. Just so you know, while I would love for Joe to only sell Bright Health and be my top producer, he does sell all, if not all, most of the other health insurance companies. So it's a great thing to work with a broker because, as I mentioned at the beginning of the call, he gets paid from the carriers that he enrolls clients into, and we all have to pay the same. So it doesn't matter whether he enrolls on my plan or another plan, he gets paid the same. And what that means to you as a consumer is that he is going to do what's best for you as his client, not what's best for the health insurance company, and not what's best for me, but for you as the customer. So I really love that Joe is so in tune with his clients. He really works very closely with them, and we work closely together to make sure that your care needs are met. And so I can't recommend enough to reach out to him, ask these questions along the way, make sure that the coverage that you have or the coverage that you're going to need as you turn 65 is going to meet the needs that you need met. So Joe, from your perspective, what are some services and things that you do that set you apart from the status quo health insurance broker?
Man, thanks, Ashley. I think I don't need to say anything else. So nice.
Don't want to put you on the spot.
Yeah, no, honestly, what I think it is I care. And I figured that out a long time ago. In this business, that's the separation. It's taking the time to learn and share and then be there for people. It's answering your phone when people call you, being willing to help in any way, shape, or form, do things way outside of signing them up just for their insurance plan, because that's the easy part. It's when things happen, when they have questions. I think that's what separates an agent, from another agent. So I take a lot of VA classes, TRICARE, Medicaid, whatever I can get information about. I want to know about it because that has to do with people in their lives. So yeah, like I said, and I love what I do, so I don't feel like I work. So that makes it fun too. I just get to help people. So thank you.
Yeah, no, thank you. And I would also just, I appreciate that you only do Medicare and that's what you focus on. So you really are, kind of an expert in your field rather than focusing on, several different lines of business and doing auto insurance and property and casualty. This is what you focus on. So, I really appreciate that about you. So I have Joe's, hopefully, can you guys still see my screen up with Joe's information? Do you still see your face up on the screen?
I do.
Okay, perfect. So here is Joe's contact information. Please feel free to reach out to him if you have any questions, or if you want to put your contact information in the chat. We do have to get permission to contact you. So if you can just put your name and phone number in there or email, Joe can reach out and follow up with you that way too. So whatever works.
Yeah, and real quick, if we have the moment, I've been doing this 11 years, and I'm so excited about what Bright Health is doing in El Paso County. It's different, it's needed, and that excites me versus being boring and just kind of showing up. I love the things that they're offering, so look into it. Again, put some stuff in the chat. We can reach out to you. We can contact you. Contact me directly. I'd be happy to speak with you over the phone or face to face. So whatever works. Thank you, guys.
Thank you.
All right, guys, thank you. I just wanted to thank both Ashley Chavez and Joe Moore for their presentation today. I've learned valuable information, which I plan on retaining and using when we get to that point. We all need to have that information, and knowledge is power. So we appreciate your taking the time to provide us with that. I wanted to let participants know that this session is recorded. So if you jumped in later, just know that if you go to the Whova web platform app in which you registered for our summit, that you can find contact information there for our presenters within their profiles, and you can further reach out. And please let us know if you're enjoying the summit and if you found this session helpful. If you need any additional information or handouts, that's a really great platform to utilize follow-up information. And from here, I will say, have a wonderful Saturday. Please, everyone, continue to be safe. And again, thank you to our friends at Bright Health, and thank you, Emily from Rocky Mountain Public Health Training, for our technical session. I appreciate everyone.
Yes, thank you very much.
Thank
and I
you.
hope everybody has a great rest of your weekend.
Thank you, guys. Bye-bye.
Thank you. Bye-bye.